So perhaps the most commonly performed procedure in plastic surgery these days is liposuction. So what is liposuction? Let's go backwards a little bit. When we're born, we have a certain number of fat cells in our body. In adolescence, that number will increase. But then basically after puberty, the number of fat cells you have doesn't get bigger or smaller, it stays the same. So the question is, well, if I gain weight or lose weight, then how does that work if there's still the same number of cells? Well, those cells are just storage devices for the fat. So those cells get bigger or smaller, but the number doesn't change. So we take advantage of that when we do liposuction. If you have a certain number of fat cells in an area, say your tummy, and I go in and I liposuction that, and I remove those cells, they're no longer there to store the fat. So I take those fat cells out. When you resume your normal weight, those fat cells aren't there to increase in size anymore. The fat cells that are left, if you gained a little weight, might increase, but we've reduced the number by, say, 80–90% of the fat cells. So whether it's liposuction, Coolsculpting, Kybella, any of those treatments are all designed to kill those fat cells. Liposuction does it by surgery. We make a little nick, we go in and we actually remove the fat. Coolsculpting does it by freezing the fat, and those cells don't do well with that freezing environment, and they eventually die and get absorbed by the body. And Kybella does it with a chemical that you inject, most commonly for the chin, and that destroys those fat cells and they get absorbed by the body. All of those things are designed to kill those fat cells in a controlled fashion so that they're no longer there to store fat. Once those fat cells are gone, the fat can't be stored, and the contour change is relatively permanent. If you gain weight, you will see increase in that area, but it won't be the same way it would have been if you had your normal number of fat cells.